The number to call us, as always, is 1-888-817-8995. Tell us why you want to scrap the gun registry or why you think it works. And we're looking primarily for some of your first-hand experiences. If you're a police officer listening in, give us a call. We'd like to hear your take. If someone has knocked at your door to look at your firearms, tell us about it. 1-888-817-8995. I want to remind anyone who is in the lineup already just to hang tight, because I want to introduce our next guest. Dr. Carolyn Snyder is an emergency and trauma doctor. She works in a hospital in downtown Toronto, and she also represents the Canadian Association of Emergency Physicians, and this is a group that wants to save the gun registry. Good afternoon.
Thanks so much for having me, Rita.
What's the essence of why your association of emergency room doctors actually sees the gun registry as a useful thing?
Well, as frontline physicians in emergency departments, we regularly witness the horrific injuries and deaths that result from firearms. And I'm frankly haunted by the many injuries I've treated. Shotgun injuries are truly brutal, as you can imagine, as are the family meetings when I've had to sit down and break the bad news on what I believe are preventable injuries and death. So while we agree that there's no room for politics on the floors of the emergency department, we do believe that as emergency physicians we have an important role as patient advocates.
Now, in a city, are you actually seeing much involving long guns? Or are you seeing more more cases involving handguns?
Well, I think in terms of numbers, we definitely see more handguns in downtown Toronto, but we get a lot of transfers from up north, and I definitely do see long gun injuries. In fact, a recent report from the Toronto Police was that 20% of firearm offenses were actually due to long guns as well. So we definitely do see long guns. The majority of the long gun injuries and deaths that I do see, however, are due to suicide and domestic violence. And this bears out in the statistics that we know that 75% of firearm deaths are due to suicide. So for us, this isn't really a rural-urban issue as Canadian emergency docs. This is truly about, and it's not really about choosing political sides at all, but it's about shifting the debate towards a public health issue.
I want you to linger there, because I think you're saying something there significant. A lot of people, at least politically, how it gets sold, you got to keep the guns out of the hands of criminals, bad guys. That's not what you're saying.
No, in fact, we recognize that the great majority of gun owners in Canada are very responsible citizens. That's not our issue. The long gun registry for us is not about treating them as criminals, but about protecting the vulnerable among us, and that's why we've taken this position.
But drawing the circle, because the majority of cases deaths involving long guns are suicides?
Yes.
And what was the statistic again?
75% of firearm deaths are due to suicide, and the latest numbers are that over 80% of those are due to long guns.
Can you give us an idea, as an emergency room doc, like how do you use the gun registry, day to day in your work? How does it actually work?
So in my job, I regularly ask the police officer if there's a gun registered in the home, and this helps me in my safety assessment. So when somebody's brought in that's suicidal or severely depressed, or if they're brought in due to a domestic violence incident, I ask that question. And of course, I'll never know, just like your previous guest mentioned, whether or not in that specific instance, whether the registry has helped me save that specific life. But that's in fact how public health measures work. We can't point to a particular person and say this particular person did not die because they got the flu shot, but we can show that fewer people who got immunized died. So when we were asked by our membership, which includes over 1,700...
Can I just I want to stop there, because this is an important example again.
Yeah.
So you're saying when you have a case, there's a patient who's come into the emergency room who's a victim of an alleged domestic assault.
Mm-hmm.
You talk to the police officer and you ask, is there a registered firearm? So what do you do with that? What do you do with that information, though?
Well, we know that a firearm in the home, it puts a patient at extreme risk of future violence or future death, because both domestic violence or domestic homicide and completed suicide are both, for the most part, very impulsive acts, and firearms are very sadly effective at those acts versus other methods.
So is it become part of like some kind of risk assessment as a
Exactly.
physician?
Absolutely a risk assessment, and part of that is maybe some actions that we take in our discharge planning, but also a lot of it's about educating both the patient themselves and sometimes the family members that are involved in the case of a suicidal patient.
Okay, I'm going to hold you there. You're going to stay on the line with us. We're going to keep the lines open for another 20 minutes or so.